I am pleased to introduce Michele Goodwin. Michele Goodwin is a Chancellor's Professor at the University of California, Irvine, and founding director of the Center for Biotechnology and Global Health Policy. She is the recipient of the 2020-2021 Distinguished Senior Faculty Award for Research, the highest honor bestowed by the University of California. She is also the first law professor at the University of California, Irvine to receive this award. She's an elected member of the American Law Institute, as well as an elected fellow of the American Bar Foundation and the Hastings Center. She is also host of On the Issues with Michele Goodwin at Mrs. Magazine. It's a podcast that I love to follow. Professor Goodwin's scholarship is hailed as exceptional in the New England Journal of Medicine. She has been featured in Politico, Salon.com, Forbes, The Washington Post, New York Times, LA Times, the Boston Globe, Chicago Sun-Times, NPR, HBO's Vice News, and Miss Magazine, among others. A prolific author, her scholarship is published on forthcoming in the Yale Law Review, Harvard Law Review, Cornell Law Review, NYU Law Review, California Law Review, and the Northwestern Law Review, among others. Goodwin's publications include 5 books and over 80 articles, essays, and book chapters, as well as numerous commentaries. For those who are formally registered in the course, just know that we made the registered pre-reading, which is part of one of her books, available to you without cost. She serves on the Executive Committee and National Board of the American Civil Liberties Union, or ACLU. She's a highly sought after voice on civil liberties, civil rights, reproductive rights and justice, and cultural politics. Prior to teaching law, she was a Gilderman Lehrman postdoctoral fellow at Yale University. Welcome, Dr. and Professor Michele Goodwin.
Well, thank you very much. It's a pleasure to be with you all. And this is a very important time for thinking about intersections of race, sex, social justice. We are at a time in which our country is now struggling across these issues. As you all know, the trial of Derek Chauvin for the killing of George Floyd is taking place in the Twin Cities. It's also in the greater Twin Cities area where Daunte Wright was recently killed by a police officer. And it's also the place that shortly before all of this, Philando Castile was also killed by police officers. It's important to take this moment to think about these issues and how they relate. As one might say, well, what about reproductive rights? We want to hear about women. Well, the last words that George Floyd was heard on tape speaking out was to call for his mother. Daunte Wright, the last call that he made was to his mother shortly before he was shot. In Philando Castile's case, his girlfriend, Diamond Reynolds, filmed his execution while her daughter, 4 years old, was in the back seat. These issues are not just issues of stress, these are issues of trauma. And this we know across myriad empirical sources. What we know is that aside from police violence, which we know has become, I wouldn't say heightened, because African Americans have been speaking of this violence for a long time that dates back to the period of chattel slavery. The original police patrols were slave police patrols. The badges are exactly identical with the same number of points as they were in the 1700s and the 1800s. So when we think about the intersectional nature of where we are today in terms of reproductive health, rights, and justice, or thinking about policing, what's interesting are the things that we've missed over time, but the things that I think are important for us to surface today. For example, what we might have missed in thinking about the horrific images of the American South, where we saw the fire hoses, the German shepherds, and the police with their batons beating on people. What we may not have paid attention to was that while that happened in Mississippi, the Mississippi River also flows up north too, and it reaches Minnesota. And in fact, many Black people there call it northern Mississippi, interestingly enough. And of course, that's the backdrop of the place that is right now in the news, given the trial of former officer Derek Chauvin. So it's important to do a bit of level setting to realize that the issues of which we speak when we're thinking about bioethics, when we're thinking about reproductive rights, when we're thinking about social justice, that these issues do intertwine. And we're not just talking about stress, we're talking about the levels of trauma that can be introduced and felt in people's real lived lives. As research has shown, African Americans about 200 African Americans per day die premature deaths in this country. It's a stunning figure, right? And there's considerable empirical evidence to back this up. So in my talk today, to zero more closely on what you've come for and to think about reproductive health, rights, and justice, let's start with this. We're thinking about bioethics and the importance of autonomy, social justice, primum non nocere, first do no harm, the talk of non-malfeasance, and of course, informed consent are the important core principles of bioethics. And in many ways, these principles of bioethics date back long before the Nuremberg trial. It was at Nuremberg that we got the Nuremberg principles that then honed down to these core principles. Out of Nuremberg came 10. And why was there Nuremberg? There at Nuremberg was a doctor's trial. Many people will think about the horrors of the Holocaust and Nazi Germany as being offenses that were committed by guards, people in the military, and people in political positions. But that was not exclusively it. There were people who were responsible for grave atrocities that were in the medical field, that were nurses, orderlies, and doctors. And these people carried out horrific platforms in Nazi Germany. But it's important also to note that one of their chief defenses was the fact that they followed what was taking place in the United States. So let's unpack that a little bit. As I say, that these bioethics principles are not new, they go back millennia. So let's just take a quick step back even further than Nuremberg, and then we'll catch up a bit. But when you think about it, what's at the center of the Hippocratic Oath? If you think about it, Cleopatra was engaged in experimentation with the people who served her. When we think about medical ethics, what's appropriate or inappropriate to do with regard to individuals' autonomy over an individual's body, these are basic core principles about humanity. And they certainly do predate Nazi Germany and Nuremberg. But let's talk about Nuremberg, and let's talk about how the United States is implicated and how reproductive health, rights, and justice also happen to be implicated. When the doctor's trial took place in Nazi Germany, and they said, well, how in the world, you Americans who've come over here to engage in this criminal proceeding against us, how in the world can you do it when we actually took pages out of your book? The reality is that they weren't wrong. What they were speaking to were their eugenics practices. They had engaged in the sterilizations, the forced compulsory sterilization of tens of thousands of people so that they would never be able to reproduce ever again. And here we're talking about individuals who were from disfavored groups, individuals who were LGBTQ, individuals that were Jewish, individuals who were from Jehovah's Witness backgrounds and other religious groups that were frowned upon by the Nazis. And specifically, what were they talking about? They were talking about a 1927 law. Well, that is a 1927 Supreme Court case. The law actually undergirding the 1927 Supreme Court case went back decades before. And here I'm talking about Buck v. Bell. It's a 1927 case that's actually based on the forced sterilization of a person named Kerry Buck. The state of Virginia was rounding up people that it deemed to be socially and morally and mentally unfit. What the platform was in the United States was that the United States would be what Germany anticipated that it should become, a place where only people who were mentally and physically superior This, of course, meant basically through a lens that had definitely been racialized in the United States. This was about white supremacy within white supremacy. Because you see, Kerry Buck was a poor white girl. This wasn't about let's find Latinx people to sterilize, let's find Black people to sterilize. Starting in the early part of the 20th century, when the United States had to address its history of coming out of slavery, its very quick dispensing with Reconstruction, it had to figure out how it was going to order its society. By law, the Supreme Court had already said that enough was enough in terms of Black people seeking equality. The Supreme Court had instantiated a separate but equal policy. We know that that ushered in Jim Crow, which was a hierarchical system of law and also of positionality within US society. If you were white, this meant any number of freedoms with regard to where you traveled, how you traveled, where you went to school, what park you went to, the street that you were able to walk on, the restaurant that you were able to dine in, the hotel that you were able to stay in, the recreational facility that you were able to enjoy, and virtually every aspect of life and law protected white people's citizenship and the ability to move freely within society. And yet, under a guise of separate but equal, Black people were gravely constrained with regard to that. And absolutely, that's a legacy that continues today in terms of where individuals are allowed to exist safely. This legacy rolls into the 20th century even more aggressively now, because now it's not just the sorting of Black people, it's also the sorting of white people too. And making sure that there is a thick line of difference between Black people and white people. Let's also be clear that there's the period of yellow peril in this country, a stereotype that had existed through the 19th century, stereotyping and stigmatizing individuals of Asian descent as being people who were hypersexual, people who would addict white women to drugs, people who were sinister and not to be trusted. This we see depicted through film, through book, through newspaper articles, and also newspaper cartoons, especially on the West Coast. In fact, this is a reason that leads to people of Asian descent not being able to naturalize in the United States until the mid part of the 20th century. I'd be happy to come back and talk about that at another time. And it is important to think about the backdrop of that anti-Asian hatred and the way in which we see it percolating today on the streets across the United States as Asian American people are being targeted for hateful offenses. The hateful offenses are the offenses that are targeting them. These are individuals just trying to go about their day, taking kids to school, going to pick up groceries, caregiving for their family members, and perhaps you've seen some of these horrific images of the people who've attacked them. It is shameful. But in this backdrop of the early 20th century, while the United States is trying to intensify its white supremacy through the uterus, the state of Virginia is not alone in adopting a law that provides for forced sterilization. And the victim of this law who goes to the Supreme Court in a test case, because there were many victims of this law, is Kerry Buck, who at 16 years old had been raped by her employer's nephew, had a child that was out of wedlock. The state of Virginia thought that she was a perfect case to go before the Supreme Court. In fact, the lawyer who represented her was a eugenics sympathizer himself. The case goes before the Supreme Court, and in one of the most chilling and horrific opinions to ever be ushered by or uttered by the United States Supreme Court, Buck v. Bell provides that 3 generations of imbeciles are enough, is what Justice Oliver Wendell Holmes says. He says that better than to let them starve for their imbecility, that society can prevent those who are manifestly unfit from continuing their kind. He says that the law that's broad enough to cover inoculation is broad enough to cover cutting the fallopian tubes. In the aftermath of this case, tens of thousands of Americans were forcibly sterilized. In Virginia, there were children who weren't even teenagers yet who were sterilized by the state so that poor white people would never reproduce again. I mean, the idea was somehow that the United States could create its Uber race. And what's interesting is much of this has been, it's recorded in law, but it's been forgotten in American history. This is what the Nazi doctors in Germany were referring to when they said that how could you possibly be charging us with this when we, in fact, based our eugenics law on yours? And that was true. After Buck v. Bell, as Germany got itself rolling up with its horrific campaign, there were legislators from the United States who were saying the Nazis are beating us at our own game. We have to ramp this up. Coming attractions and movie theaters often advertised, here's how many hundreds or thousands of people have been sterilized in this state or that state. For any of you from the Midwest, if you're familiar with state fairs where they fry Snickers and put them on a stick and many other things, and people pin blue ribbons and red ribbons on cows and sheep, well, guess what? In the United States, at those state fairs were fitter family contests, where families availed themselves to be pinned as being the fittest family, provided their kids held up their children. See this bluest eye child, this blondest hair child. This is part of a legacy that the United States has papered over. Many have, and that's many do not know. Some law professors were not taught about these issues in law school. They may have learned about one significant case, Skinner v. Oklahoma, which involved a man who was a petty thief, and in the state of Oklahoma, where he had been charged with the crime of stealing chickens, Oklahoma had a law that provided that if you were a petty thief, you could be forcibly sterilized, but you were exempt from this if you were a white-collar criminal. Again, pointing to the deep class stratification of such rules in our society. In the aftermath of Kerry Buck's case, there were more than 60,000 people who were sterilized in the United States. Later on, we know that these campaigns were enforced against Indigenous women, against people in Puerto Rico, and we also know that the practice of sterilizing those under the auspices of the Mississippi appendectomy targeted even young Black girls, where their parents had no idea that when taking their children to receive medical care, that their daughters were actually being medically compromised. This is why bioethics matters, and this also gives us some idea about why it still matters today, especially in the wake of what has been informed, how we've been informed during 2020 of individuals who have sought asylum in the United States being sterilized coercively in American detention centers. And these are issues that are present and amongst us today, even in California, a state that protects reproductive rights in its state constitution. In California prisons and jails, women have been subjected to coercive sterilization, and there's ongoing legislative efforts to try to address these kinds of issues that have come up. And I commend to you a recent documentary called Belly of the Beast. And it's a great documentary for you to see. I think that you can still find it online for free. It was on PBS. And certainly if you just take a look at the trailer, you'll see that there's a lot to engage with there. So what are the kinds of issues that I'm talking about in my book, Policing the Womb, which addresses the history of reproductive injustice in this country and what's happening today? Well, the concerns of today are not just about access to contraceptive health care and also abortion, which are significant concerns. In 1973, the Supreme Court struck down criminalization of abortion in a 7-2 opinion written by Justice Blackmun, who was Republican appointee. He was appointed by Richard Nixon. He wrote the opinion in Buck v. Bell. 7-2 is not a close opinion. And in that case, he wrote about how abortion had not been illegal in the United States at the time of the Pilgrims. And in fact, abortion had only become criminalized around the time of the Civil War. And we could talk about now, perhaps during Q&A, about why that was. But abortion being criminalized had been a more recent kind of phenomena, a kind of politicization, and what he might also reference as a real sense of patriarchal enforcement against the lives of women. He talked about how women's lives were deeply affected by not being able to make the choices with regard to their reproductive health care that should be their own, how this would affect their educational possibilities, employment possibilities, how the failure to be able to make independent, autonomous decisions with regard to one's reproductive health care could lead to physical health harms as well as psychological health harms. Roe v. Wade was a case that fit after cases like Griswold v. Connecticut, which struck down laws that criminalize access to contraception for married couples. It followed Eisenstadt v. Baird, which then struck down laws that criminalized access to contraceptive health care for individuals who were single. And then there was Roe v. Wade. But Roe v. Wade was not the panacea alone that many people hoped it would be, or one could say that the cases that followed after Roe did not provide the promise of Roe. That is to say that there were cases that followed that basically distinguished who really could have access to pregnancy termination. And basically it meant that while the state was willing to pay for a person's pregnancy to go through labor and delivery, that states were not willing to pay for pregnancy terminations. Now, at this point, it's important to note that the price differential was really quite significant. And also it's important to note that a person is 14 times more likely to die by carrying a pregnancy to term. So when one thinks about what the state has been willing to do, including in these times, the state is willing to pay for a procedure where a person is 14 times more likely to die than that involving a pregnancy termination. And that's just real life fact. And the political backdrop has changed dramatically since Roe v. Wade. The time leading up to Roe v. Wade was one in which there were numerous instances of people who were dying by botched abortions on their dining room tables, in their bathtubs, in motel rooms, many dying alone. Today, the backdrop of the attack on reproductive autonomy includes attacks against transgender youth, which we see very recently. We see the uptick in criminalization against and the targeting and surveillance of people who are pregnant, primarily of women who are pregnant, but there's also discrimination against trans men who are pregnant or who would like to become pregnant. And this has included the arrests of women for falling down steps while pregnant. It's included the threats of arrest for women who refuse a C-section. It's included laws where, like in the state of Texas, in the case involving Marlise Munoz, where the state wants to basically confiscate a pregnant, brain-dead person's body in order to force it to gestate fetuses. It is a time in which there's been a dramatic encroachment against the reproductive independence of women. It's been a dramatic rollback, and the rollback has had significant consequences. The United States now leads the developing world in the rate of maternal mortality, infant mortality too. Data from the Central Intelligence Agency ranks the United States about 51st in the world in terms of maternal health and safety during delivery. It's more dangerous to give birth in the United States than it is in Saudi Arabia or Bosnia. Texas and Louisiana are considered the deadliest places in the developed world for a person to give birth. If you happen to be Black, the rate of death happens to be about 4 times that as a white person. And it's dramatized even further if you happen to live in Mississippi, certain parts of Mississippi or Georgia or Louisiana, where the rate of death can be 10 times as high as a white woman or 17 times as high as a white woman. These are not issues that are being addressed by the legislators in those states who are seeking to criminalize or make it more difficult for individuals to be able to have access to abortion health care. And even beyond abortion, access to contraception has also become a challenge, though I will say this, that the Biden administration has restored some of the benefits that had been struck down by the Trump administration through Title X. And it's important to note that the health consequences of so much of this action has led to significant health harms. The United States has seen now the resurgence of congenital syphilis. The rate of STIs amongst youth exceeds that of all of our peer nation countries. It's horrific, and we know that certain STIs provide a greater risk for cervical cancer and other kinds of cancers later in life. So the ways in which the United States has basically flipped the direction that it was going in Roe v. Wade has now resulted in some very significant health harms, reproductive health harms to people, which would make it seem like this does not make sense. And it also means that the attacks on contraceptive access and also abortion access has actually resulted in the closure of clinics that would provide abortions. But those same clinics that provided abortion also provided contraceptive health care, and they also provided prenatal health care, and they provided screenings for STIs, and they provided breast cancer and cervical care screenings. And with their closures, now it means not only do the people in those areas and regions not have access to pregnancy termination, but it also means that they don't have access to contraception. It also means that if they become pregnant, they don't have easy access to prenatal health care, all of which create maternal and also infant health risks and concerns. And it's important to understand these issues for what they are. So we are at a time in which some would describe the attacks on abortion rights as death by 1,000 strikes. That is, that it's not about just the one single law that would basically undermine or end the right to terminate a pregnancy, but it's the creation of myriad laws that target people with the possibility of becoming pregnant and making it very difficult that they have access to the kinds of resources that they need. And let me end with this. When we're thinking about resources, it's not just those which I've described, but resources in terms of information. So what else is it that we know? The work of Naomi Kahn and June Carbone reveal the following. Their work reveals that in red states, there are higher incidences of divorce, out of wedlock pregnancies, high rates of online pornography use, high rates of teen pregnancy, high rates of STIs, and so much more. In the very states that are seeking to encroach upon reproductive health care and rights are the states in which people are suffering. These are the states in which people are dying. These are the states in which people who want access to reproductive health care have to go elsewhere. But I mentioned a resource other than some of the technical ones that I was talking about or medical ones, and this happens to be education. In the backdrop of all of this has been also the rollback of sex education in middle and high schools. While there are countries, including our allied nations, that are finding ways to talk with children and have the appropriate conversations as early as elementary school, in the United States, abstinence only has made a strong resurgence. That is, no sex education, rolling back sex education classes that had dated back to the 1950s, 60s, and 70s, with now no sex education, or sex education being supplanted by abstinence only. And in states that have these abstinence only policies, we see what the results are: teen STIs, teen pregnancies, births out of wedlock, high maternal mortality, high infant mortality, and also births that go into individuals needing to be on public assistance. Now, I think public assistance is very important for our country. I believe social safety nets are really important, but we're also looking at systems where we've not provided the basic foundations for young people to be able to have independent, healthy, educated lives by removing the kinds of informational resources that would allow them to know about their bodies. Abstinence only is not an answer for young people who want to know about how their biologies function. How do people become pregnant? How do you prevent STIs? What to do when you are raped? How to get the kind of care that you need. What is emergency contraception in case you have been raped? When we deny access to these basic fundamental tools, then it reminds me of what Dr. King said in 1966, amongst which was that of all of the injustices in our society, inequity in healthcare was in fact the worst. And he said this was because it could end in someone's death. And with that, I think I'll wrap up and open up for any Q&A.
Nice positive end to a nice positive talk. I think it provides a really necessary into how common of a rhetoric it is. And so much of, I think what your point, much of the points that were made in your talk tonight can be applied to a lot of different elements that we've explored in this health policy elective in any political discussion. The same rhetoric that's used to explain how attacks on the Affordable Care Act were made, the death by 1,000 cuts, is exactly the same way that the Trump administration attempted to undermine the Affordable Care Act. The same rhetoric around who's deserving of certain benefits or access is the exact same rhetoric that was used to explain what we call the narrative of exclusion in Joni Eiten's talk around what America has and how America has decided to distribute its resources. So I want us to really, really understand how intersectional the discussion around reproductive justice is, because it's the same political tactics that are being used to undermine a lot of other social services. And so I want to thank you for starting there, Professor Goodwin, because oftentimes people think reproductive justice is just a conversation about abortion, and it's so not.
No, it's so much more. And let me just say this, that when Sojourner Truth said in the 1800s, "Ain't I a woman?" many people remember that speech for the power of her narrative with regard to chivalry. But she also said in that speech, "I bore 13 children, and nearly each one snatched from my arm. And nobody heard my cry but God. Ain't I a woman?" These are histories that have a long inflection point in these United States.
Absolutely. And can be echoed today. That same cry is echoed by pregnant people and laboring people today. It does not have to be a woman that was enslaved, a woman that was born
Children in cages just a matter of months ago. Nearly each one of my children snatched from my arms. And there you have it.
So a question I certainly have, as we invite anyone else to ask questions of Professor Goodwin in the chat, a question I certainly have is what you believe the role of providers current trainees, future physicians, etc., to be in addressing a lot of society's continuous ills, either from a legal perspective or an academic one?
I think that there has to be the demand for certain types of training. So, one thing that's deeply disappointing to me is the failure to mandate a full, comprehensive training within the reproductive health care sphere, including how to terminate a pregnancy, which I think is incredibly important. When we hear that you're 14 times more likely to die by carrying a pregnancy to term than by terminating it, it should mean that one knows how to perform an abortion, right? That I think is critically important. And at some point, it was understood that this was something that people didn't have to know how to do. But if you're interested in saving a patient's life, then it is something that is important to know how to do. I would also say that when we think about the history of medicine, you know, doctors, nurses, people who are in medicine have been complicit with racism over time. It's not new to us. The American Medical Association barred Black doctors from becoming admitted to the organization. In the 1800s, it was argued that the reason why Black people had to be kept out was because they were trained at Black medical schools that admitted women, right? So it was kind of a proxy, sort of sexism being used as a proxy for racism, racism being used as a proxy for sexism. And it's only been within the last couple of decades that the American Medical Association has issued a public apology for that history. And again, we have to do the work of truth and reconciliation within our own spaces to acknowledge these horrors. But those horrors were not left in the 1900s. We know that throughout the 20th century, up until the time of 1966, when funding changes came about, that there was explicit segregation in medical hospitals and training centers in the United States. This was something that President Lyndon Baines Johnson fought hard against. Interestingly enough, it was the Voting Rights Act and the Civil Rights Act, 1965 Voting Rights Act and 1964 Civil Rights Act, that Johnson gets the most attention for. But his work to expand Medicaid was critically important, and connected to that was the urgent issue of making sure that there was the desegregation of medical facilities in the United States. There were Black patients who died literally on the steps of white hospitals where doctors and nurses refused to provide care for them. And if we were to think about whether that's old news or new news, the sad thing is that it may be new news to some people who are hearing it now, but the instances of these things are not changed. In my book, Policing the Womb, I begin with a chapter on Barbara Dawson, a Black woman who shortly before Christmas, just a few years ago, dies literally right outside of the Blountstown Hospital. This is after she had been in the hospital. A Black grandmother who could not breathe, who calls an ambulance, gets in that ambulance, says that she can't breathe, goes to the hospital, says she cannot breathe. The hospital becomes frustrated with the Black woman who says she cannot breathe and calls the police on her. The police arrive and the police say, well, now we must arrest you, which is not an answer. They say, we must arrest you because the hospital has told us that you are trespassing. Since when is a patient trespassing? Who's saying that she cannot breathe? And you can hear the audio from the officers recording his lapel pin that he's recording. Is very, very calm about this. And this is why it's really important to be nuanced about racism, because as my students hear this, I ask my students what they hear. And they hear Officer Tadlock being very calm. We're going to arrest you now. Put your hands behind your back. You've been trespassing. And what you hear is Miss Dawson saying, but I can't breathe. I can't breathe. And my students say, well, that sounds loud. He's really calm. She's loud. And she's saying, my God, I can't breathe. And he's saying, playing around like this isn't going to stop you from going to jail. why should it be logical that a Black woman saying she can't breathe while she's in the hospital should result in you're going to jail? And what we learned from the officer's report is that an orderly at the hospital helps him remove the oxygen from Mrs. Dawson. And the orderly helps handcuff Miss Dawson, putting her arms behind her back. And the officer in his police report writes about how he then pushes her out the door. And then we hear Mrs. Dawson crying out again, but I can't breathe. I can't breathe. She collapses. And you hear the officers saying, playing around like that isn't going to stop you from going to jail. And then you hear her niece saying, but she can't breathe. Her niece is crying, but she's told you she can't breathe. And then you hear the officer saying, she's all right. She's all right. She just needs to get up. Mrs. Dawson died right there. So when I talk about these histories and why we need to know about them is because they're right in our rearview mirror. They are with us today. They are with us today. And one of the most painful things to hear is the cry for someone saying that they can't breathe. And it doesn't have to be under the knee of an officer. It can be in an American hospital.
I think a takeaway there from that story, as harrowing as it is just to believe our patients. That's one of the easiest ways that we can avoid some of the pitfalls that our implicit or explicit biases can create. So many stories that we hear about how and why Black and brown, minoritized, queer, disabled people end up either with poor outcomes or actually dying under our cares because we just didn't believe one of their complaints because of our internalized belief about what was right or what is healthy or what is the correct presentation for a patient, etc. And I think a really good takeaway here to almost answer my own question is to say that we should just listen to people and take what they say as much as we can at face value.
Well, that's absolutely right. I mean, it's an awful lot of effort to just fake it, right? We do know that there are patients who suffer from psychological harms that manifest such that they then seek care. But that's such a slim part of the population that might suffer from that. But yes, believe your patients. I mean, we know that Black patients are less likely to get the pain medication that they deserve, less likely to get the gold standard of treatment that their white counterparts would receive. But basically, as a first line, what if you're worried about it, is to think about, well, what would I do if this patient were white? If this were a white grandmother in front of me, what would I do? What kind of care would I provide? What kind of care would I provide if I understood that this person had my status? If this were another doctor that I were providing care for, if this were a person that was educated at the institution that I came from, if this were, my spouse's parent, if this were my child, that kind of familiarization, which is not the benefit that Black and brown patients receive, but it is certainly what they deserve. And we know that these stereotypes exist. A study from the University of Virginia just a few years ago of medical students and residents revealed something that was quite shocking to researchers, which was that medical students and residents harbored many of the outdated stereotypes that people thought would have been over in the 1950s and 60s, believing that Black people have different skin density, that their blood coagulates differently, that they feel pain less than white people do. So these stereotypes are alive in people who are coming into the medical profession. It's not people that, one might say, well, they're older, they're trained at a different time. Well, those people, may very well, and data would show that implicit and explicit bias lives in medicine. So that's, one can point there, but that's not the only place where one should point. There are people who are coming into these spaces who also harbor implicit and explicit biases.
We all do. Well, we want to thank you for being with us, Professor Goodwin. But Reese, did you have anything to add or ask?
Yes, I actually wanted to follow up on your invitation earlier in your talk when you had mentioned a little bit about the history of how abortion became criminalized during the Civil War, and if you could talk a little bit about that.
Yes, well, it was a coming together in many ways of a perfect storm. That is to say that uh, there was the placing of gynecology and obstetrics as a place of science and medical learning, which had not been before. And if you think about it, there were no people sort of running around with stethoscopes and lab coats during people's delivery millennia ago in parts of Africa or Asia. Much of this work had been done by women and midwives. Nearly 100% of reproductive health care in the United States had been done by midwives. But with experimentation, some of which, and a lot of which, had been on enslaved African women in the United States, there had been tools that had been developed, these tools that could be used in gynecology. And there was the rise of obstetrics and gynecology, but it was a field that was not respected as others had been in medicine. And so you find in the writings of Horatio Storer and Joseph DeLee a lot of insecurity and complaints that they're not receiving the respect that their male counterparts are, who are physicians. And you can probably guess it. There are physicians that are saying you're just doing women's work, and you're doing Black women's work because half of the midwives in the United States are Black women. And this becomes a political lightning rod for people who wanted to basically monopolize in this space. Men who were becoming men of science of the uterus, who wanted to claim this space for themselves. And the American Medical Association became a tool for them. It was through the American Medical Association that they were able to lobby for laws that would burden the work of midwives, imposing licensure structures and regimes, and licensing structures and regimes that would regulate these women, impose certain costs and certain fees. Abortion became a convenient kind of scapegoat. And much of this, right? How do you push these women out? Well, you claim that these women are engaged in a substantive evil, that they are doing something wrong. I mean, there has to be some strategy for these men to come in and take over this field for themselves. And you keep in mind as well that they are complicit in other ways. As medical schools begin to build out these programs, they also exclude women, right? Women are excluded from these medical schools. And so sphere and space where Black women had been deeply involved, and white women and indigenous women, they ultimately end up being shut out. But it's the perfect storm because it's also around the time of the Civil War. And what you see now is what you saw then. There has forever been this concern about Black birth, right? Like too many Black people will overwhelm the United States, right? Like the backdrop of these political times are like, Black and brown people, it's too many of them. And this is a level of argumentation that they were able to use as well, right? They actually wrote, we need white women to go spread their loins east and south and west and north. I mean, this is in their writings, right? I mean, it's deeply racialized, this kind of fear of the coming of Black people who are about to be freed from slavery. And we're going to be all overwhelmed and brown with all these hyper reproducing Black people. And so we must make sure that abortion stops, that white women begin producing, and then also engage in anti-immigration campaigns to try to keep out Asian women, hence the Page Act, and then also monitor which immigrants are able to come in. And it's all a part of this perfect kind of loop. And the AMA is deeply involved in it. There's a professor at the University of Minnesota Law School, Christopher Roberts, who writes about this. And it's a chilling account, very accurate account about the AMA being politically involved in racist campaigns, basically, that follow a kind of political agenda. Thanks for that question, Reese.
Thanks for the answer. Do we have any other questions from our listeners today?
Well, it's been a pleasure to be with you. I wish you all a good evening. Good luck with what you are doing. This is important work. And I wish you all a very good end. Where are you in your quarter? We're on semesters in the law school.
Yeah,
And
so this is just a 2-week elective
okay.
that's free for our clinical year medical students to take for formal credit, our non-clinical year medical students to join for transcript notation, and any other student or professional to join per lecture. So
All right. That's
yeah, so we
wonderful.
are at the beginning of our second week, so halfway into the elective.
That sounds terrific. Well, it's a pleasure to be with you all, and I wish you all very well. And let's see, someone's asked for my contact information, putting it here. Let's see. All right. All right. Be well, everybody.
Thank you.